This is Alex Otto, a Women's and Pediatric Dermatology Seminar in Newport Beach, California. Dr. Hilary Baldwin had some great advice for treating acne in adult women.
So let's start from the beginning. There's a lot of reasons to be discussing acne in women as separate from acne in children and acne in men. Number one is unknown, which is the epidemiology of the whole thing. We know there are a couple of studies that show that it's more common now. Is it really more common? Like, do more women have acne than they did 20 years ago? Or is it that more women are coming to see docs because we're targeting them more? There are a lot of direct-to-consumer advertisements now for the adult woman saying, we recognize that you're in pain, come see us. Also, I think sometimes the adult woman now is coming in for treatment of her kids, and she realizes that medications in the 2000s are a heck of a lot better than medications were when she was a kid. The second is that I think women are more psychologically and psychosocially impaired than the teenagers with acne. They either have it for the first time, which is horribly psychologically impactful, or they had it as a teenager, it went away and it came back, or they've had it the whole time. Doesn't matter. They are alone. They're isolated because they're probably the only ones they know. They're the only ones in the workplace, and they get all sorts of unsolicited advice, like you ought to drink more water, or you need to relax more, or maybe you're not eating right or not sleeping enough. Crazy stuff that has nothing to do with acne. So happening in maybe 25%, I would say, of adult women. So not uncommon at all anymore. Now, how do we take care of them, right? Is that any different than it is in the teenager or the adult man? And yes, it is. First of all, we have to worry about whether she's going to become pregnant, or perhaps whether she's lactating, and that's a whole other story for another day. But that certainly factors into how we're going to treat her. We have one medication that apparently works better in women than it does in men, which is topical dapsone. And we don't know why it works better in women than in men, but clearly is more effective. We have a couple studies dovetailing on that demonstrate that with the topical retinoids, that they don't seem to be any more effective in women, but they are certainly as effective and no more irritating, especially in the kind of acne that women have down in the lower jaw. Adult women either have acne all over their face, just like they did as teenagers, or they can have this kind of acne in a U shape around the jaw and onto the neck, which is more difficult to treat and is on more delicate skin, so you can't necessarily use a topical that's going to give them as much oomph because it's so irritating that they have to stop using it. In adult women, there are medications that you can use that you can't use in men. You have topical, birth control pills and other hormonal modalities like aldactone, which is, men don't appreciate being treated with birth control pills and anti-androgens. They find it off-putting. But it's a very useful treatment in the adult female, particularly aldactone or spironolactone. Very effective in adults, been around since the 1950s, an androgen blocker, an anti-androgen, so it reduces the androgen levels in the adult women, even if they have normal androgen levels. So often, many of us, when we see an adult woman, we're going to check her androgen levels along with perhaps her FSH, LH to see if she's in menopause. But we're looking at DHEAS and testosterone, both free and total. And if her hormone levels are normal, we'll say, oh, well, then we won't be using the anti-androgens. But it's been very clearly shown that even if your androgen levels are normal, even if your hormone levels are normal, that spironolactone may very well still be effective in you.
Doctor, with spironolactone, is there a limit to the duration of therapy?
There is no limit to the duration of therapy with spironolactone because it has no long-term side effects that we know of. There's no cumulative side effect potential. So as far as I'm concerned, the patient can use it for as long as is necessary.
And doctor, this is a therapy that might be underutilized because people check the hormone levels, the androgens are normal, and then they think they don't need to use this drug.
Right.
Is that a fair statement?
It's a very fair statement. There are many reasons why people don't use as much spironolactone. Firstly, there they're not aware of its existence. It's not something that's talked about all that often until recent times. Secondly, it's not FDA approved for the treatment of acne. Now that, of course, doesn't stop dermatologists, because perhaps 70% of the medications we use are used off-label, but it's not FDA approved. The third is that it has a black box warning in it for its use that was added actually only about 3 to 4 years ago, despite the fact that the medication's been out since the 1950s, talking about its use, concerns about carcinogenesis, which has limited its use, even though there is no case report that I can come up with of any kind of problems in human beings. Then the pregnancy issue also comes up. Technically, it might cause testicular feminization if a woman gets pregnant and is carrying a male child, although that also has never appeared in the literature, despite the fact that the medication's been out since 1950. So I think you put all those things together and people are a little leery about using it, but it's a wonderful drug.
Doctor, is this drug subject to a registry?
It's not a registered drug. You know, there's no reason for it to be so, but there is. It certainly is recommended that you check pregnancy tests, or that you at least make sure that the patient is not pregnant when starting off the medication. But other than that, it's not a registered drug at all.